Hi, I'm Dr. Michael Franger, and I'm a resident physician at New York Presbyterian Brooklyn Methodist Hospital. In this module, we'll be discussing all the medications you may be taking. So, why are you taking these medications? First, to have more energy and increase your activity. Helps you breathe more easily and reduce that swelling in your legs. Also, stay out of the hospital. To feel better and live longer. So, a common question is, I'm feeling well. Why is my doctor increasing my dose? So, heart failure medications work best at certain doses. They help you feel better. They also improve your health in the long run. These are the different medications you may be taking. ACE inhibitors, those pril medications, lisinopril, enalapril, ramipril. The benefits: live longer, less hospitalizations, feel better, and be more active. Take it one time per day. It blocks harmful stress hormones that may make your heart failure worse and helps lower your blood pressure. Some side effects, more common: dizziness, low blood pressure, and high potassium levels. So be sure to follow up with your primary doctor. Less common could be dry cough, and rare could be lip or throat swelling. If you experience any of these symptoms, please reach out to your doctor or healthcare professional as soon as possible. Managing some of the side effects could be with ankle pumps or sitting on the side of the bed and slowly rising to prevent that change in blood pressure from sitting to standing. The ARBs, the angiotensin receptor blockers, the sartans, losartan, valsartan, are some examples. The benefits are very similar to ACE inhibitors, but if you cannot tolerate an ACE inhibitor due to lip swelling or cough, you may be placed on this medication. Take it also one time per day. Blocks those those harmful stress hormones. And the side effects are very similar to the more common, less harmful side effects of the ACE inhibitors. The ARNIs, or Entresto, this drug is used to replace ACE inhibitors. It's been shown to help patients live longer and reduce hospitalizations. You take it 1 to 2 times per day, and it blocks these stressful hormones that make your heart failure worse, and it regulates heart rate. Side effects very, very similar to the angiotensin receptor blockers, and the less common, or the more common, but less harmful side effects of ACE inhibitors. So a common question may be, why is my doctor always increasing my dose? So there are 3 different strengths, and the higher dose, the better the function. But we will work with you for whichever dose you tolerate the best. Beta blockers, metoprolol, carvedilol, bisoprolol. The benefits: you live longer, less hospitalizations, you feel better, and it helps improve heart function. You can take it 1 to 2 times per day, depending on which medication. And it blocks stress hormones as well. That makes the heart failure worse. Some side effects may be fatigue or dizziness when first starting, and it may take a while to feel better. It may take a couple of weeks. Wheezing if you have a history of lung disease, slow heart rate, which is one of the benefits as well for someone with high heart rate, and it helps lower blood pressure as well. So again, why is my doctor always increasing my dose? The right dose is the right dose that works for you. The higher the dose, the better the function of the drug. However, not everyone can tolerate a high dose, so whichever one you tolerate the best will work with you. The diuretics, the water pill, Lasix, torsemide, Bumex. The benefits are less hospitalizations. They make you feel better, reduce that swelling in the legs and in the lungs. You can take it 1 to 2 times per day. The action is it gets fluid out. Less water in the lungs, breathe easier. Less water in the legs, less swelling. Some side effects could be low blood pressure, low potassium, dehydration, and increased urination. So some common questions are, the diuretic is making it hard to leave home. How do I fix this? So for starters, plan ahead of time. It works similarly, the drug, every time. After the first several days of taking it, note when you go the most, plan trips ahead of time, and find the bathroom when you're out. take several hours before going out as well could be a potential help. The diuretic is waking me up, so you may have to adjust when you take the diuretic. You may have to take it hours before bed so you don't wake up in the middle of the night. My legs are swollen. I'm still short of breath. Call your healthcare provider and weigh yourself daily. If you do experience this, please get in touch with your provider, or visit the emergency department. We constantly adjust the dose depending on how you're feeling. If you're gaining weight, the dose is likely not working. And sometimes you may be short of breath. You may find, is it working? Do I take an extra dose? So in this case, do not take an extra dose. I would refrain from taking any extra doses before speaking to your healthcare provider first. The next class, the SGLT2 inhibitors, dapagliflozin, empagliflozin, canagliflozin. The benefits: help you live longer, less hospitalizations, feel better, improve that heart function. 1 time per day, and it decreases workload of the heart and improves function. Some side effects: low blood pressure, low potassium, dehydration, and increased urination. And an added bonus benefit is that it reduces A1C for diabetics. The second part of medications that you may be taking: isosorbide dinitrate and hydralzium. The benefits, especially seen and studied in African Americans, is living longer, less hospitalizations, and feeling better. It's 1 to 3 times per day, depending on the medication. And this relaxes the blood vessels, allows the heart to work less. Some side effects: you may have headaches, especially in the beginning. This does improve with time often. Dizziness, nausea, lightheadedness, low blood pressure. And importantly, do not take this medication if you're taking medications with erectile dysfunction. Always speak with your healthcare provider before taking this medication or any medications in general. Next class, ivabradine. The benefits are for those with stable heart failure, and it helps reduce hospitalizations. It's 2 times per day, and it lowers the heart rate, so your heart doesn't have to work as hard. Some side effects: one thing to note is that there are drug interactions with this, so please let your doctor know everything you're taking beforehand. The next class is digoxin. The benefits: less hospitalizations, takes it once per day, helps the heart beat stronger. Some side effects may be nausea or vomiting. And for someone who takes this medication, you should look out for any blue or green yellow vision. If you do experience this, please let your doctor know right away. Other medications: anticoagulants or blood thinners. Many of you may be on this medication. Some patients with heart failure require this to help prevent blood clots. Ask your provider before taking this medication, or when you do take this medication, about foods to avoid and getting regular blood checks. The next class is potassium pills. You may need this if you're taking a diuretic, because this does reduce potassium in the body. And you may not need it if you're taking an aldosterone antagonist, because this actually increases potassium. And also if you have kidney disease as well. So ask your provider about this medication and regular blood checks as well. The next class is NSAIDs, naproxen, aspirin, ibuprofen. Why should you be cautious? It can cause kidney problems in combination with your heart failure medications. And it can worsen your heart failure if you are taking it with certain medications. So once again, always communicate with your provider. Only use it if it's prescribed. And often for aches and pains, it's beneficial to use Tylenol. And for herbal medications, always disclose the medications you're taking with a doctor. We're here to work with you. Anything that you take over the counter, anything you take medicinally, just let us know, and we'll work with you on, and we can always investigate them together. And keeping track of your medications, keeping a list, to update it, carry it with you, the name, the dose, number of times per day. Get a pill box, label the days of the week, the times per day, and plan ahead. If you're going away, bring enough. Work with your healthcare provider. We are happy to provide you with medications to last vacations or long trips. And reorder ahead of time. Let us know when you're running low. Common question: do I take my medications if I'm feeling well? Yes, you're feeling well often because you are taking these medications. They're working with you. The benefits of these medications are keeping you out of the hospital, living longer, and symptomatic free. So please keep taking your medications unless otherwise stated by your healthcare provider. These medications block stress hormones that make your heart failure worse, and your body needs them to keep feeling well. So I want to thank you for bearing with me during this video. I hope you learned something. Your healthcare providers are here every step of the way. And I wish you the best and good luck with the rest of the modules. Thank you.